very different from Western countries because their population got on board with public health mitigations. Like, as soon as they were told to do things, they did them. So they wore masks, they did a lockdown, they did what they needed to do, they monitored temperatures, they also they did something on their phones, I think. They did a very
like a QR app thing.
yeah, they had like some kind they had some kind of contact tracing thing that was required for them to do. So they did a lot of public health mitigations that above and beyond what we're doing in the West that I think were effective for them, and they were able to get rid of I don't think they don't even have many positive cases anymore. So it gives you hope to see countries like that, and Australia, like Victoria, Australia, I think has had 0 cases now for like a month or something.
Yeah, they're doing really well.
Yeah. So it gives you hope that and it also kind of frustrates me because we look at these examples and then we see people so resistant to public health mitigations, and it's like, this can work if we all work together, but it's the people that don't want to participate that kind of keep it spreading, and
I think another thing is people automatically, because China's so how do we put this nicely?
Not willing to tell the media what's happening.
Yeah, so secretive. And
so there's a lot of people that, so when, at the beginning of this, it's interesting that you say that, because as an epidemiologist, at the beginning of this pandemic, a lot of the data that we had on COVID-19 was Chinese. And people would say, well, that's not real data because it's from China. And I'm like, what? Like, I don't know what you're talking about. Like, it's just, to me, that's, like, I trusted the public health people in China, but there was very much resistance to accepting any data that came from Wuhan about this virus, but that was all we had, So it was like we had no choice but to take it.
I think it's the Red Scare thing again, isn't it? The communists, so automatically they're in the wrong.
Yeah, I mean, I don't have any kind of, I know what you're saying, but yeah, from a public health perspective, we really had no choice but to act on the data that we had because, the alternative was worse by doing nothing.
Yeah.
Yeah.